Hello, good afternoon. I am Dr. Sanjay Bafna, pediatric pulmonologist, Bharati Vidyapeeth Medical College Hospital, Pune. Today I am going to talk about the sleep related issues in children and what we can do for these children in our hospital. So first of all, you must be wondering what is there to discuss about sleep, because sleep is a common normal part of our day-to-day life. So that's what we need to discuss today. Sleep is a part of our routine, but you can imagine that almost 1/3 of our life we spend sleeping. Therefore, that means there has to be some purpose for this activity. So, what does sleep offer us? Now, basically, sleep is important for a variety of reasons. It not only is important for physical rest, which we all know, but it is equally important for mental health or mental rest. So during sleep there is restorative activity which happens during sleep. Whatever we have learnt or during daytime gets further emphasized, what we call as mental restoration, which occurs in sleep. So you can understand that this is very, very important and crucial for children, because their memory consolidation, their learning, their cognition, all that would depend upon good sleep. So then if the child is not sleeping well, then of course his physical and mental health gets affected. Apart from that, the learning and cognitive abilities also are hampered, and in adults many times sleep deprivation is associated with diseases like diabetes, hypertension, obesity, etc. In children, sleep is also important for good physical growth, because the growth hormone gets secreted during sleep. Now, what is the normal requirement? So, मतलब पेरेंट्स पूछते हैं कि कितना घंटा सोना चाहिए. So ये जो है, this depends on the age of the child. Younger children would sleep for almost 10 to 12 hours. Gradually the sleep needs come down, and in older children the requirement is around 9 to 10 hours, but minimum 9 to 10 hours of sleep is required in children. Now, what can go wrong in sleep? The most common issue which we see in day-to-day practice is sleep deprivation, the less sleep. Children are sleeping less nowadays. And why is it happening? This is not because of the problem or the disease. Most common cause is what we call as poor sleep hygiene. So we talk about hygiene in general. There is something known as sleep hygiene. That means these are the measures or a group of activities which we perform so that the child has good normal sleep, and that includes having a good consistent schedule for a child, that this is going to sleep at 9 o'clock, get up at 6 o'clock or 7 o'clock. Then second thing is, of course, avoiding mobile media exposure. This is very common, which also interferes with sleep. Having a good sleep environment which is soothing, which is less light, less sound, all this are called as sleep hygiene. Less of caffeine use, no sleeping after 3 or 4 o'clock. So all this will help the child to have a good quality and quantity of sleep. Now coming to another important thing is, all the sleep problems, they are normal, they are only related to sleep hygiene, or there are serious issues? Yes. So there are certain problems which we call as sleep related problems or diseases, and that's why we have celebrated this World Sleep Day in the month of March, where we want to create awareness about sleep related problems. Now, sleep related problems in children can be because of less sleep, which we have just discussed, or it may be because of the quality of sleep is not good. So what can go wrong? The child is sleeping adequately, but his quality is affected because he is not able to breathe properly during sleep, which is known as sleep related breathing disorders. And the most common cause is because of the adenotonsillar hypertrophy in these children. Even obesity is on rise. The obese children also are not able to sleep well because of their obesity or adenoid hypertrophy. Then other issues may be because of parasomnias, the abnormal behavior which children have during nighttime sleep. Lastly, there are certain medical problems like asthma, allergic rhinitis, which also make the child not to sleep well. Then there are other uncommon sleep problems which happen in particularly syndromic children, which is not the routine problem. So what can we do? In Bharati Hospital, we have a sleep clinic which runs from Monday to Saturday every day between 2 to 4. You can seek help there, and we are there to help you. What do? We go through the detailed sleep history, analyze the sleep pattern, and see if there are any issues related to sleep, because it is unless we discuss, the parents are many times not aware that their child is having a sleep issue. Then once we go through this, we offer as far as possible the non-medical management and sometimes medications, and some children may need support, and that means they may need further investigations, like we do sleep study or polysomnography, which is performed, we have a high class, world class sleep laboratory in Bharati Hospital where we do level 1 sleep study. Once the study is performed, some children may need a support for breathing, which is known as a BiPAP or CPAP machines, which is very rare or uncommon situation. In most of the situation, the simple talking, history taking and detail analyzing, and then of course helping them through establish a routine helps in most of the children. So I hope I have emphasized enough about the sleep in general, sleep related hygiene and sleep related problems which are common, and we need to create awareness in parents, in doctors and communities about sleep related problems. Thank you so much.